Very much thankful to everybody for your constant blessing. So recent advances in the treatment of hypertension, according to my all slides are from the Brownwell textbook of cardiology, which is that Abhishek is using for DM cardiology knowledge. So this 2024 ESCA clinical practice guidelines, this is date is very important. 31st August 2024, European Society of Cardiology. And now the global burden of hypertension is very high, and around more than 10.8 million deaths each year. As per the epidemiology is concerned, 20% of the world adults are estimated to be hypertensive, and 1 out of 5 adults are hypertensive, and 7 out of 10 hypertensive patients are uncontrolled. It is just like a brakeless car which is going on the Samruddhi road. So, what are the complications? We know that heart attack, brain hemorrhage, and you might have observed that our patients are very argumentative. Observed that US guidelines recommend single pill combination for those who are 20/10. And initially it was called as a heart pull disease. And the initial treatment was that they used to apply leeches to reduce the blood pressure. And there is a one sentence in one book that somebody will come and reduce your blood pressure. He must be stupid. So initially, all our seniors, they were not allowing us to use alpha methyl dopa also. And the president Roosevelt, he died because of the brain hemorrhage, because there was no system and your blood pressure should be treated properly. So only two things are important. Patient should not go for the CKD. Patient should not go for the heart attack. Patient should not go for the stroke. Because when he develops stroke, I call it is half death. He is alive, but he is not moving. All this routine works is done by their children, so they are also very frustrated. Somebody is a fan of amlodipine and somebody is a fan of cilnidipine. Now there are two physicians, Dr. Nakle and Dr. Khobragade. So which drug? Dr. Nakle will say, I am in the government college, amlodipine is slightly cheaper, I will use amlodipine. But I will say I am in a private practice, I will use cilnidipine with telmisartan. Why? Because cilnidipine lowers the ambulatory blood pressure at par with the amlodipine and also reduces the pulse rate. Amlodipine, while equally effective in the lowering the ambulatory blood pressure, but increases the pulse rate. So pulse rate is very important. You are lucky when your pulse rate is between 58 to 65 beats per minute. If your pulse rate is more than 100, your survival chances or these heart failure chances are more. Cilnidipine showed significant improvement in the aortic blood pressure and arterial stiffness and marked reduction in the mean heart rate with an